Hello students, welcome to EduPharm, Believe and Become, classes for GPAT and NIPER-JEE. Like and share the video and subscribe to our channel. Hit the bell icon to never miss any update. Today's topic is pharmacology of anti-epileptic drug. Now, first we have to know about the epilepsy. Epilepsies are a group of disorders of the CNS which is characterized by paroxysmal cerebral dysrhythmia manifesting as brief episodes that is called seizures with loss or disturbance of consciousness with or without characteristic body movement, sensory or psychiatric phenomena. Now, let's talk about seizures. Basically, seizures is the sudden uncontrolled electrical disturbances in brain. This is the physical findings or changes in behavior that occur after the electrical activity in brain. So, these seizures can be classified based on where they begin in brain. That is, what is the origin of these seizures. The first one is generalized seizure. Both sides of the brain is affected by this and cause loss of consciousness. We can further categorize generalized seizures into different types. As you can see, generalized tonic-clonic seizures, absence seizures, atonic seizures, myoclonic seizures, and infantile spasm, which is seen in infants mainly. And the second one is partial seizure. This is also known as focal seizures. These affect initially only a portion of brain but may spread to small or large area or to the whole brain. This can be further categorized into simple partial seizure, complex partial seizure, and simple partial or complex partial seizure, secondarily generalized. Seizures can happen as a result of an imbalance between inhibitory and excitatory process in brain that produces either too much excitation or too little inhibition in brain. So, we have to understand how this happens, and for this, we have to understand how signals are passed by neurons. That is from one neurons to another. So, let's move on to the mechanism of seizures. Communication through the neurons occurs through traveling of electrical wave excitation, and this is called action potential. Action potential is happened by synchronized opening and closing of ion channels. Here you can see the neurons contain the voltage gated sodium channel and calcium channel and various receptor like GABA receptor, AMPA receptor, NMDA receptor, etc. So, in case of simple excitatory neuron, in resting condition, intracellular concentration of ion is negative than the outside. That means there is slightly more negative ion inside. Action potential starts when voltage gated sodium channel open and allow positively charged sodium ions into the cell. Thus, the reversing of the polarization of membrane happens, which is called depolarization. Consequently, the depolarization leads to opening of high voltage calcium channel. which then allow positively charged calcium ions enter into the cell. And this opening triggers the release of glutamate ion from the vesicles into the synaptic cleft. And then this glutamate binds to two types of receptor on the postsynaptic neuron. One is AMP receptor. Binding with this receptor open and permit the entry of sodium into the cell. Then the NMD receptor that permit the entry of calcium ions, and here the calcium ions may enter through the low voltage activated calcium channel, that is a T-type calcium channel. In response to the small depolarization, these channels open. All this influx of positive ion again leads to depolarization and propagation of action potential. If there is too much glutamate around the neurons, can become hyper-excitable and a seizure may result. But this normally doesn't happen because there is also have inhibitory neurons around that put brakes on excitatory impulses. These inhibitory neurons release neurotransmitter GABA, which binds to GABA receptors on the excitatory neuron, cause them to open and allow negatively charged chloride ions to enter in. This causes the membrane potential to be more negative on the inside relative to the outside, thus limiting the neuron's ability to respond to further stimulation. Finally, once this GABA dissociates from the GABA A receptor, it becomes removed from the synaptic cleft by reuptake through the GABA transporter, that is GAT1, and then degraded by an enzyme called gamma aminobutyric acid aminotransferase, that is GABA-T. So again, with the excess glutamate, too little GABA can also allow neurons to become hyperexcitable, which may lead to seizures. Now, let's have a look on classification of anti-epileptic drug. It is chemically classified as different groups, that is barbiturate, deoxybarbiturate, hydantoin, imиностилбин, aliphatic carboxylic acid, succinamide derivative, benzodiazepine derivative, and phenyltrazine, cyclic GABA analogs, and the newer drugs. So, from the discussion of mechanism of seizure, I hope you can understand where the drugs can be act. So, the aim of the anti-epileptic drug is to lower neuronal excitability or enhance neuronal inhibition. So, these drugs may act by four mechanisms. First one is by blocking of sodium channel. By blockade of sodium channel, reduce the sodium ion that enters into the neuron. And the drugs which comes under this group are phenytoin, carbamazepine, valproate, lamotrigine, topiramate, and zonisamide and lacosamide. And the second one is blocking of high voltage calcium channel. Another way we can say inhibition of excitatory glutamatergic synapse. And the drug comes under the group is phenobarbital, phenytoin, lamotrigine, topiramate, valproate, and levetiracetam. And then the third class is inhibition of T-type calcium current, that is low voltage calcium channel. And the drug is ethosuximide, another one is valproate and zanisamide. And then the last class, which is the facilitation of GABA-mediated chloride channel opening. And barbiturate, benzodiazepine, vigabatrin, valproate, gabapentin, and tiagabine are this class of drug. For detailed mechanism of barbiturate, you can go through our previous lecture. Link is given in the description box. And let's move on to the ADR of the drug. So sedation or dizziness are common adverse effect of anti-epileptic drugs. And there is another adverse drug effects. Carbamazepine cause hyponatremia, that is decrease of sodium ion, and double vision is caused by lamotrigine. Visual field loss is caused by vigabatrin. Phenytoin caused gingival hyperplasia. Topiramate caused weight loss, whereas valproic acid can cause weight gain and liver toxicity. And peripheral edema is caused by gabapentin.
So that's all for today. Check out more of our videos. Feel free to ask any question about the video, and also you can suggest the topic for our next video. You can also support us. For details, check the description box below. Your support will encourage us for making such videos. Thanks for watching. Hope to see you in our next segment. Till then, keep your preparation on and stay tuned with EduPharm.